James Kaufman, World News Report today, December 29th, 2024. God bless you and yours, no matter where you are in the world. Please subscribe, give us a thumbs up, ring that bell for critical future updates. Dr. Leana Wen urges everyone to get the bird flu vaccine as soon as possible. Here we go again. Dr. Leana Wen, the communist doctor who demanded Americans lose all their rights during the COVID pandemic, appeared on CBS's Face the Nation on Sunday to discuss the bird flu outbreak. I've heard of 66 cases and no deaths. I'll let you guys listen to her yourself, but Wen pushes for extensive testing and says we already have a human bird flu vaccine and everyone should be seeking to be vaccinated. They're pushing really hard over a virus that does not appear to be particularly deadly to humans. The flu appears to be more deadly. What could possibly be going on unless there's a reason they want you to take another vaccine? Amid concerns about the bird flu, the Biden administration should be making rapid tests available and ask the FDA to authorize the already existing H5N1 vaccine, says former Baltimore Health Commissioner at Dr. Leana Wen. I feel like we should have learned our lesson from COVID. She was so tyrannical, right? During COVID, Baltimore might remember. Let's listen to her push her narrative that I'm sure was forced on her.
What should be happening in the Biden administration right now that isn't going on?
Yeah, there are two main things that they should be doing in the days that they have left. The first is to get testing out there. I feel like we should have learned our lesson from COVID that just because we aren't testing, it doesn't mean that the virus isn't there. It just means that we aren't looking for it. We should be having rapid tests, home tests available to all farm workers, to their families, for the clinicians taking care of them so that we aren't waiting for public labs and CDC labs to tell us what's bird flu or not. And the second very important thing is, this is not like the beginning of COVID where we were dealing with a new virus, we didn't have a vaccine. There actually is a vaccine developed already against H5N1.
Now wait, if we're not sick and most cases are asymptomatic, why do we care if we have the bird flu? And why would we ever put a test up our nostril? None of this makes any sense whatsoever. They wanted to see if we'd fall for it again. Hey, fool me once, shame on you. Fool me twice, shame on me.
The Biden administration has contracted with manufacturers to make almost 5 million doses of the vaccine. However, they have not asked the FDA to authorize the vaccine. There's research done on it. They could get this authorized now and also get the vaccine out and to farm workers and to vulnerable people. I think that's the right approach because we don't know what the Trump administration is going to be doing around bird flu. If they have people coming in with anti-vaccine stances, could they hold up vaccine authorization? If they don't want to know how much bird flu is out there, could they withhold testing? I mean, that's a possibility. And I think that...
Why would it matter if it's not killing people or hurting people? What we've learned is the vaccine can be just as dangerous, if not more so, than the, disease or virus itself, period. You're not fooling anyone. Adios, amigas.
The Biden administration in the remaining days should get testing and vaccines widely available so that at least it empowers state and local health officials and clinicians to do the right thing for their patients.
Dr. Wen, is bird flu in humans super dangerous?
Well, the World Health Organization estimates that in prior outbreaks of the bird flu, that the mortality rate is 52%. 52%. However, in this most recent outbreak, it seems that most cases have been mild, and maybe some people even have asymptomatic infection. But the question is, we don't know what happens when bird flu affects more vulnerable individuals. People infected so far in the U.S. have been mainly farm workers who are working, presumably generally healthy, as opposed to what happens when you get to children, to pregnant women, to older individuals with chronic illnesses. We don't know how deadly, how dangerous bird flu is going to be for those individuals. And again, that's one more reason why we don't want it to spread.
Now, the doctors and the CDC say that some of the strains of bird flu have a mortality rate of up to 50%. But let's read here. Starting in March 2024, the Center for Disease Control and Prevention, or CDC, set up a national program to watch for signs of human risk from the H5N1 virus. As of mid-September, it had monitored more than 4,800 people. It tested 240 of them that had been exposed to infected animals. Of those, it found 14 cases in people. Worldwide, only 29 human cases have turned up across 9 countries. 7 people have died. By comparison, seasonal flu kills an estimated 300,000 people or more each year. Some bird flu infections are mild. You might have no symptoms, but if you do get sick, you might have a cough, sore throat, pink eye, conjunctivitis, a runny, stuffy nose, headaches, or body aches. You might find yourself short of breath. Some people develop a fever and get very tired. More severe cases might cause diarrhea, vomiting, pneumonia, and even seizures. But the important thing to keep in mind is that so far, there's been no sign of person-to-person spread of H5N1 bird flu. So, we've had 14 people that tested positive, 29 around the world. Of those, 7 people have passed away, and the regular seasonal flu kills over 300,000 people each year. I'm thinking I'm going to take my chances with this. What about you guys? I think we're all tired of giving up our freedoms, and I think that this lady is a nut job, period. 7 total deaths, and there's no telling what else these people had complications with. Was it only bird flu, or did they mark the cause of death bird flu 7 times globally over the last year? Completely ridiculous to have millions and tens of millions, hundreds of millions of doses of this vaccine being prepared, and for everyone to hit the airwaves begging you to take the vaccine. I personally, think that there may be a problem here. Please share, subscribe, and always remember, anything's possible in Bizarro World.